Well, it's very nice of you to be here, Shania. I certainly appreciate you coming and interviewing for this externship position. Please tell me a little bit about yourself.
My name is ECPI House. I am 20 years old.
Recover.
um, I will be graduating from ECPI this past June as a medical assistant with an associate's degree of applied science. I've been working at Kroger Pharmacy for the past month. There, I've learned how to fill drugs and cashier regular stuff, and I've learned how to deal with insurance companies too. And I've worked initially in customer service for 4 years. I used to work at Marshalls before Kroger, and there I mostly did cashiering and stocking in the back room, but that is mostly about it.
Okay. Well, River City's cardiology we are a full service cardiology group, as I like to say. We do not send our patients out for lab work. We do not send them out for anything except coronary artery bypass graft surgeries. We even have our own cardiac catheterization suite. So we would be training our medical assistants to actually assist us in the cath lab that we have here on site. But I'll get to that here in a minute. Essentially, though, our medical assistants are going to be working exclusively with a certain physician, and we do have multiple offices. And when you are paired with a certain physician or advanced practitioner, if that practitioner is at a different office on Monday, different office on Tuesday, different office on Wednesday, the medical assistant would go with them. Would that be a problem for you to go from site to site to site?
No, I don't mind traveling.
Okay, very good. Typically, the practice is very busy. Each advanced practitioner will see about 40 patients per day. We schedule in 15-minute increments, so our matrix starts at 8 a.m. sharp, and we see patients every 15 minutes. And our medical assistants are going to be fully cross-trained. They are going to be able to serve in scheduling and patient follow-up in the clinic. They're also going to be in the physician's office laboratory. They're going to be doing revenue cycle management and billing and coding. And also, with enough time here at the practice and going through the various levels of career development, we will have our medical assistants working in the cath lab with the physicians to assist them. So again, we make sure that our medical assistants are fully cross-trained because it is a very busy practice, and if somebody does call in sick, or if a physician gets called away for an emergency heart catheterization, we need to have other medical assistants cross-trained to pick up the slack. On campus at ECPI, what were some of the courses that you felt like you excelled in?
One of the courses I feel like I excelled would be phlebotomy. I did earn my CPT certification in that class, and I feel like I did really good in that class. I maintained a grade of an A, and I understood most of the draws that we did. Um, we did some urine sampling too in that class, and my other class would be the EKG class because I earned my certification in that class, and I maintained a grade of a B, but that was only because I messed up on our first quiz, but I did redeem myself with our last one.
Okay, very good. I'm glad you got some certifications. It's always nice as an employer to hear a third-party verifier of somebody's credentials. We obviously have a strong partnership with ECPI University. We are an educational partner with them. But at the same time, it is nice to hear that an outside organization verifies someone's skills. So we definitely place an emphasis on medical assistants who already have skills, or excuse me, have certifications demonstrating their skills in the field. Can you tell me, are you a certified medical assistant?
Not yet, but I will be receiving my programmatic certification at the end of this month.
Okay, very good. We need to have our medical assistants being programmatically certified. We do have nobody on staff who is not a certified medical assistant. So we realize that in order for us to be able to operate at the highest level that we are and receive the reimbursement through CMS that we have to have all certified medical assistants. Part of the interview process, because we are a very active program here at River Cities Cardiology, we do a shadowing interview with our medical assistants. There's this part of the interview, but there's also a shadowing interview. Having said that, I want to ask you a few questions. If you go over to the whiteboard, I would like to have you demonstrate a little bit of your knowledge before we even do the shadowing interview. Since you mentioned your knowledge of EKG and how well you did in EKG, could you please just draw a cardiac cycle, the EKG waveforms associated with one cardiac cycle, and then explain that to me, please? That's okay. Okay.
This would be our P wave. This would be our Q. This would be our
Okay. And what do each of those waveforms, what does P, Q, or ST mean, for example?
So our P wave is the first contraction of the heart, and the Q wave is the first inflection. No, the P wave is the first inflection. The Q is the first contraction of the heart, and the R wave is the can't remember that one right now.
It's okay.
But the S is when it comes back down. I think that is when the I can't remember the S.
Okay, that's fine. What about with phlebotomy? What is the main vessel that you are going to be trying to perform the procedure on?
The main vessel.
Right. What's the name of the vessel that would be your primary target when you are trying to draw blood from a patient?
So the antecubital fossa.
That's where it's located, but there's a little more specific.
The vein. You mean?
Right.
Okay, so there's 3 different veins you can draw from. Well, you shouldn't draw from each of them, but you can.
Okay.
The cephalic, the basilic, and the median cubic.
Good job. Okay. Go ahead and have a seat. Do you have any questions for me, please?
Yes. With someone with my experience, what would you expect from me?
Well, as I mentioned, all of our medical assistants are going to be cross-trained. And we want to make sure that we start off with a very well-educated and preferably skill-specific and programmatically certified medical assistant. That way they will be able to take on more advanced training. Onboarding and on-the-job training is very costly and time-consuming, and we want to make sure that we are investing our best efforts and, of course, our resources financially in somebody who can take on more skills. So you will be learning our electronic health records program. We use Athena here. You will also be utilizing our medical office laboratory. You will be performing billing and coding. And you will also, of course, be in the clinic using your clinical skills to assess a patient's vital signs, perform mensuration, reconcile their medications, and, of course, log in all that information into the patient's EHR. We do have our own on-site cardiac catheterization suite. And because of that, we train medical assistants who have gone through all of the other training for physician's office laboratory scheduling, billing and coding, and clinical. We train them if they have excelled and shown that they have the aptitude for it. We train them to assist the physicians in the cardiac cath lab. We'd much rather have a physician have a set of hands that they always worked with versus a rotating group that wouldn't know the physician as well and the physician wouldn't know their capabilities as well. So we would really like to have all of our medical assistants essentially take on the skills of a surge tech so they could assist them in the cardiac cath lab. But that's not the primary focus initially. It's the basic medical assisting credentials at first. We do partner with ECPI University. We are an enterprise partnership with them, and so that's why we give ECPI graduates priority interviewing if we do have a medical assistant position available. That partnership allows medical assistants who graduate from ECPI and are employed by us to receive a substantial discount if they do decide that they want to return to ECPI University for more education. The education that we would reimburse for, though, would have to be some type of education that would help our practice out. So in other words, if you do decide you want to return to ECPI University, you couldn't necessarily go to the culinary school to learn how to be a chef. We would much rather you go to ECPI to return to go to their sonography program or the registered nursing program. But again, we do want to try and train our medical assistants in all aspects of our practice. Our practice manager is a former medical assistant that was employed here, and we decided who better to oversee the entire practice than somebody that had worked in all areas of the practice. And so we do want to hire from within, and we do want to make sure that everyone is trained on the job in the way that we do things.
Okay.
Any other questions?
Yes. So, what other certifications should I receive, or am I qualified?
Well, we definitely want you to earn that programmatic certification, which you will at the end of this month, as you had mentioned. And we understood from speaking with your program director that all of the medical assistants would be earning that certification before they started their externship. Any of the certifications that you can acquire, even as a graduate, the electronic health records, billing and coding, would do nothing but help you. We do reward for medical assistants. The more certifications they have, we will increase your pay commensurately with earning those certifications. We will also send you away for different types of training as it arises. And of course, also, if you are showing the aptitude to take on more skills, you have to master a basic set of skills within our way of doing things first before we'll give you the option to go and acquire more training. But we do want to make sure that our medical assistants are well trained, and we do want to promote from within. We do want to offer continuing education. We know you all have to maintain your certification, so we offer continuing education that helps you maintain your certifications, but ultimately it does help our practice as well. You are going to be more qualified to work with our patients the more certifications and the more training that you receive. We have a long-standing track record of people staying here for a long period of time. Typically, the only time people will leave is if life gets in their way. A husband gets transferred, or they decide that they don't want to come back to work after they have a child. But we have many employees who have been here 10, 15, and 20 years and longer because of the excellent working conditions, the high level of patient satisfaction that we always strive to achieve, and the fact that we do reward for hard work and proficiency. Okay. Any further questions?
No, it seems like a great company.
Well, thank you so much, and we will definitely be in touch with you soon. Thank you.